Hi, I'm going to speak for myself. As a self-employed person, I'm going to speak for myself. As a self-employed person, I'm part of the middle class for whom health insurance was killing me. I wasn't dying, but it was killing me. I had to pay almost $900 a month for insurance because that's all I could get. And it ate up a lot of my savings, and I'm speaking for all the middle class people who are also affected by this. Also, I have a niece who has her first job for a small company who can't afford to give her health insurance. So she's going to be having to pay $500 or $600 a month for insurance. And she's just a kid in her first job out of college. This is our future. We can't do this for our kids. We can't do this for the middle class people who are facing retirement. And until they get there, they have to shell out $900 a month. Thank heavens I'm on Medicare now, and it's wonderful, 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 wonderful. And all these people who say that public health insurance is not good, they're wrong. I can go to any doctor I want to, and I don't have to pay $900 a month.
Folks, I need you to work with me here and give me a little bit of energy. I'm going to say, why are we dying? And you're going to respond, we don't know. So why are we dying?
We don't know.
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 Thank you very much. I hope we get an answer soon, because people are still dying. That is why we are here today. We are here to honor the people that are dying unnecessary lives every single day. By the time we are done here, 5 more people will have died. This is senseless because the corporations want their profits. This is outrageous. Are we a civilized society? If we continue to let these lives go, let these folks die, we are not a civilized society. There is things that we can do. We are passing around flyers that have Gillibrand's number. Call Senator Gillibrand. Call Senator Schumer. Call Obama. Put the pressure on him. Obama wants the pressure on this. He wants to push this through, but he won't do it unless we put the pressure on. In addition, you can join up with us. We have sign-in sheets going around. Join MoveOn.org. We are Move On, and we are trying to get to move on from these unnecessary deaths. Please come join us, and please come help out.
I thought that I had a stomach flu or food poisoning from bad chicken. On Monday, my brother saw me look ashen and urged me to go to the hospital. My wife was pregnant and my little girl was due in a couple of months, and I didn't want the added burden of an ER visit. I needed to hang on to our finances. I was a freelance cameraman and we did not have health insurance. I thought, I'll just wait, but it got worse and worse. By the time I got to the hospital and was admitted to surgery, it was too late. I died on Thursday, August 3rd, 2009 from a ruptured appendix. My daughter was born 2 months later.
Thank you. I suffered for 10 years with back pain, but couldn't afford medical care. When a midlife divorce left me single and without insurance, I started a home business selling makeup on eBay to support myself and 2 daughters. I didn't qualify for Medicaid, and I couldn't afford our monthly insurance premium. I took comfort in my faith and attended church regularly until one Sunday when I didn't show up. The next day, my daughter received the call telling her that her 51-year-old mother died from undiagnosed heart disease, a condition that would have been treatable if I could have afforded the care. I sure wish I could be there for my daughters now.
the mammogram radiology department. I was employed at a hospital for 6 months full-time and then went in for my regular mammography screening. The results were not good. I had a lump in my breast and needed to go in for a biopsy. I eventually required full-fledged cancer treatment, radiation, and chemo. During this time, I started to receive notices from my insurance company that the care would be denied. They claimed the cancer existed prior to my becoming employed at the hospital and receiving that coverage. So they denied, delayed, and denied. As a result of this, I didn't get the care that I needed. The insurance company had drawn the line, and I was on the side of the dying.
Hi, my name is Dr. Sharon Phillips. I'm a family doctor. I work in the Bronx. I'm here because hundreds of people die every day for lack of health insurance. Thousands more are permanently disabled because they don't have health insurance and are afraid to come to the doctor. I saw a patient in the emergency room. She'd been having chest pain. She'd been having chest pain for weeks, on and off. She didn't come in because she was scared of how much it would cost. When she came in, it turned out she had a very serious condition known as a ruptured aneurysm, which basically means that inside her chest, one of the big arteries that feeds the heart was open. It was too wide open. They took her to surgery. She died that same night. Hundreds of people die every day. Thousands more every day are permanently disabled. People have strokes. People's kidneys stop working. I can't take care of people if they are too scared to come in and see me because they don't have enough money. Everybody deserves secure, affordable health care, no matter what. So I think we all need to call our senators. We need to call our friends and tell them to call their senators and congressmen. We need to tell them to tell their friends. We need to keep fighting for this until we get it, because I can't be a doctor in a system if people are too scared to come in and I can't help them.
Thank you so much. That is the prescription, folks. That is the prescription. We have a sick society. We are not taking care of our sick. 122 people are dying each day. 44,000 lives are being lost unnecessarily each year because we are not caring for our sick. All we need to do is pass the public option, and these deaths, these unnecessary deaths, will stop. There are things that you can do. Call your senators. We have the telephone numbers here. Call Obama. Join our ranks. MoveOn.org. We would love to have you be involved. Enough of these senseless deaths. We are dying symbolically here today, but people are dying all across the United States. For what reason? For greed. The greed of the insurance companies and the corporations. We say enough. Why are we dying?
We don't know.
Why are we dying?
We don't know.
Why are we dying?
We don't know.
We need a public option, and we need it now. All right, who's up? Woo!